And welcome back to Life Unrehearsed. Matt Del Vecchio here, specializing in life transitions, downsizing, and the senior living industry. It's January, yes indeed, slip sliding away, plenty of slips and falls outside. But did you know there are more slips and falls inside the home? Well, we wanted to address both of those issues, so we reached out to a specialist in the field, Dr. José Morais. Dr. Morais is a professor, faculty of medicine, McGill University, director, division of Geriatric Medicine. He's their lead for the dementia education program. In fact, I was very fortunate to be a co-panelist with Dr. Morais on a segment of McGill Cares. It's a wonderful webinar series hosted by Claire Webster. Dr. Morais, welcome back to Life Unrehearsed.
Good afternoon. Thank you for this kind invitation.
Well, thank you for joining us here. Let's first start talking about, slips and falls, particularly in older persons. And why is it that the older people tend to have recurrent falls?
Well, it's because there is some factors associated with aging that predisposes the older person to fall. I mean, we know that with age, our reaction time is delayed. There is more visual problems. We know that with age, one gets more chronic diseases that affects the joints, the balance, and for all of these reasons, once an older person falls, he has at risk to fall again. So this is the main reasons, and there is ways of preventing falls. It's why it's important to talk.
Yeah, and it's also the statistics, right, Dr. Morais, are mind-boggling after a fall. So we really have to try to prevent those falls wherever possible. And we tend to think of falls in the wintertime outside, but, inside the home could be dangerous. So can you give us some examples, Dr. Morais, of where do we fall most inside the home?
Yeah, you're right. I mean, people tend to fall where they live, so there is more falls inside than outside. And, believe it or not, the room in which we fall the most is in the bedroom. Because early in the morning we tend to stand up very quickly. Sometimes it's because one needs to go to the toilet. And in the rush, then we don't pay so much attention to carpets on the floor, and if it's in the middle of the night, it's also dark. For all of these reasons, we fall more in the bedroom than any other place in the house.
Interesting. So, and I see that and I hear that all the time. If you have to go to the bathroom and it's dark, there's not a night light. Lighting is huge, and you may be a little bit lightheaded getting out of bed. And so, what other rooms within the house are also considered hazardous?
Yes, the second place in the room is the bathroom, because it's sometimes humid and slippery after taking a bath. When we stand from the toilet seat. So these are frequent areas of falls, and in the bathroom, it's also associated with more injuries because you can lose your balance and eat surfaces that are very, very hard, and as a consequence, there is more injuries in the bathroom. After that is the kitchen, where we tend to do some activities in the kitchen. Occasionally we have to get to the cupboards that are higher. Then we take a stool and you have not used it for a while, so you're off balance and you fall and you injure yourself. For all of these reasons, houses are more a site of falls than outside of the house.
Mm-hmm. Which makes sense. This is where we are most of the time, and this is where it seems to be most dangerous. All right, those are some of the areas. Now, what can we do specifically focusing in on inside the home, Dr. Morais? What can we do to prevent some falls inside the home?
Yes, of course, there is things that one can do to prevent falls, including verify that our carpets and rugs are in good conditions, that there is no cords from a light or a phone that is in the way. We should also walk at our usual pace rather than rushing because someone knocked on the door or we are in a rush to go to the toilet. These are little precautions. Make sure that there is no wet floor where you are walking, and even inside or outside is have proper shoes. You shouldn't have high wheels. In fact, the wheels should not be higher than, let's say, 3/8 of an inch. You should be comfortable. They should stick well to your feet, not to have it too loose. All of this can reduce, in a significant way, falls. But there is also factors associated with the person that we have to work on it, for which appropriate exercise is highly recommended.
Yeah, I think that's a very, very good point. I'll also throw in there bathrooms are seeing more and more demand for grab bars. And, of course, you mentioned before, lighting is absolutely crucial, isn't it? Especially in bathrooms, in bedrooms, and get those night lights on. And lighting is very, very important. You're listening to Life Unrehearsed. Matt Del Vecchio here. And I'm talking to Dr. José Morais. Dr. Morais is the Director, Division of Geriatric Medicine at McGill University. Okay, Dr. Morais, we're going to switch from inside the house, and let's head outside. Where do you see most of the falls happening outside the home?
Well, it is usually in the dans le trottoir, in the trottoir, in the
so sidewalks.
Sidewalk,
yes,
sidewalk. And the reason for it is because the sidewalks are not even. We have to pay attention, or else because it's very slippery, like days like today. And we have to be extra careful. We also fall because we try to run because the light is changing from green to yellow, and sometimes it's out inside of the stores when we don't pay attention and looking at the shelves, and then accidents do happen. But think about the sidewalk as a major site of falls in older people.
And especially because sidewalks aren't level, right? There's different areas and places for wheelchairs or what have you, and dip and up and down. So for sure. Any suggestions now to what's the best things to do to prevent falls outside, Dr. Morais?
Yeah, some of it resembles that of inside, which is having proper shoes and the right boots, so that you can move with more ease and flexibility. If it has been suggested for you to use a cane, or a walker, do not leave the home without these devices to support you, and pay attention to the lights. So when you cross, you go at your pace. If you start rushing and accelerating, you might lose your balance and things. Then there's other consequences such as a fall. For all of these reasons, when you are outside, you have to be more cautious. There is also something else we need to discuss, which is the fear of falling. After a person has fallen once, they become very fearful, and they reduce significantly their walkings, their activities outside, and this is counterproductive. So if ever an older person is feeling, fearful of falling, this needs to be reported to the physician. So we need to do some appropriate exercise for the person to regain his or her confidence and get rid of this fear of falling. To that purpose, Matt, I have developed a program of exercise available for free on the web, and it's just a question of accessing it and practicing the exercises that are proposed. You just need to imitate the person doing the exercises, and then over time you acquire more flexibility, strength, and balance that will prevent falls. Exercises, let's say, reduces the risk of falls by 40 to 50%. So it's not negligible. But we need to tell the physician when we visit that we had a fall, because sometimes falls are also due to medication and diseases that are not well controlled. Right. And there is a need for physiotherapy, exercises. And I think we have to think prevention rather than, having difficulty walking and then have consequences of the falls that leads to visits to emergency room.
Yeah.
And falls can be prevented in a large majority.
You bring up a good point about the psychological aspect, the fear and the confidence, and exercising is so important. We're going to get that website at the end of the show, okay? So we'll ask you for that. We're going to switch gears. We have to head out to traffic, Dr. Morais, but when we come back, geriatric medicine is your specialty, and there's a new book that was recently published, and it's called The Care of the Older Person, and Dr. Morais was a significant contributor to this book, and we're going to talk about some of the highlights in that book, including proper nutrition, combating ageism, and the state of the geriatric medicine world. But first, let's head up to the CJD Traffic Center, and we're going to hear from Jill Fitzgerald. And welcome back. You're listening to Life Unrehearsed. My name is Matt Del Vecchio, and my guest is Dr. José Morais. Dr. Morais is the Director, Division of Geriatric Medicine at McGill University. Dr. Morais, we're going to switch gears a little bit from the slips and falls, some wonderful words of advice, and we're going to put up mention that website at the end of today's interview. But you are one of the major contributors of a wonderful book called The Care of the Older Person. Can you tell us a little bit about the book?
Well, certainly. I mean, I was approached by the main editor, Dr. Ronald Kaplan. He's alumni from McGill. He practiced all of his professional career in New York City as a gynecologist. He's retired, and he was feeling that his patients that were postmenopausal were complaining that physicians don't understand all the problems of older persons, especially women. And he returned back to McGill colleagues asking, what can we do? So he approached me, and together with other colleagues from the Division of Geriatric Medicine, we decided to create a book dedicated to primary care physicians and to students and residents in medicine, covering most of the important aspects of aging in a language that would be accessible without too much scientific details that makes the understanding a bit encumbrant, but with practical aspects, how to identify and treat conditions. And this led to this book called The Care of the Older Person.
Yeah, and Montrealers should be proud. There's a great Montreal contribution to this. Dr. Serge Gauthier, yourself, Claire Webster, and it's a great book, The Care of the Older Person. We're going to talk a little bit more about that. But first, Dr. Morais, as our population ages, we're seeing more what we're calling ageism. And I'll define that. And basically, ageism means it's a prejudice or discrimination on the grounds of a person's age. So do you see this happening in your world? And what can we do, all of us, to be more sensitive to it?
Yes, I agree. I think a bit of this is our culture in which we value, a lot of activity, very effective. In a short period of time, we have to produce a lot of results, outcomes, etc. And older persons, they are considered to be too slow. They are retired, so they are not participating in this effort of progress as they consider. And as such, there is a negative view of what the older person can do and contribute to society, which is wrong, because I can assure you that at the level of the family as well as of the community, older persons contribute in a great way to the well-being of the community. We all know how older persons help their middle-aged children with financial issues, even contributed to the upbringing of their grandchildren. These are important contributions, including, those who are retired to do a lot of volunteer work, who participate in a lot of community get-togethers and activities and festivals and all kinds of activities, right?
Yeah.
So it's a bad perception of the contribution of older people.
I think so, right? And it's an incumbent on all of us to make a difference and to try to avoid ageism and be sensitive to that. You're listening to Life Unrehearsed. Matt Del Vecchio here. My guest is Dr. José Morais. Dr. Morais is the Director, Division of Geriatric Medicine at McGill University. Dr. Morais, I want to get back to the book, The Care of the Older Person. You write a chapter about the state of geriatric medicine, one of your specialties. What are some of the more important challenges and opportunities in geriatric medicine?
Well, due to the aging of the population, the number of older persons are growing in an incredible speed. I give you an example. At the present time, we are 1.8 million of Quebecers that are above 65, and over the next 10 years, this number will grow to 2.3 million, which is about an increase of half of a million people in such a very short period of time. So because of this increased number of older persons, there is a need for geriatricians. Remind you that all specialists and family medicine should have the basic understanding what are the needs of older persons and how to deal with most of their problems, and leave the very odd cases, very difficult cases to geriatricians that were trained to deal with the problems specific to older people. So not every older person needs to have a geriatrician, you see. Mm-hmm. But still, the growth of the specialists in geriatrics doesn't follow that of the aging of the population. As a consequence, there is a lack of specialists in geriatrics, and this is a well-recognized fact. Things have improved a little bit recently because there's a greater interest from residents in medicine to apply to geriatrics. So we have seen an increase in the numbers of residents training in geriatrics, which is a good sign.
Absolutely.
But I think that in Canada, we did a study with friends from other provinces, and we are about 300 geriatricians for the full country, and we would be in need of double that.
Yeah, easily. So, I see that a lot, Dr. Morais. There's an increasing demand, and it's only normal. The demographics show that, and our population is aging. I want to get to a very important chapter in the book called The Care of the Older Person, and this is one of your specialties, is nutrition. And you talk about malnutrition in older persons. So how do you diagnose malnutrition?
Well, it's not so complicated, because malnutrition leads to weight loss. So anything significant involuntary weight loss can lead to malnutrition. There is cutoffs, and if you lose more than 5% of your weight over 6 months, regardless of the cause, and if it is involuntary weight loss, this is a case of malnutrition. Then the onus is to find out why is this happen. And in case of older persons, it can be very complex because it includes not only physiological problems, health problems, but also the way one organizes his life.
And we talk about those slips and falls, that could also be contributed to. Dr. Morais, we have 30 seconds. How do you treat malnutrition? Any quick recommendations?
Well, first thing is really determining the cause that is behind. For example, difficulty with groceries, meal preparations, and then provide the help. Or if there is disease, to deal with the cause of decreased appetite or decreased food intake. Malnutrition is unfortunately frequently missed, but is a treatable and reversible condition for the most cases. Mm-hmm. So physicians should be more alert and sensitive to the problem, and it's a marker of deterioration. So if you're malnourished, you end up having problems with walking, with your self-autonomy.
Right.
So it can be preventable.
It can be. We want to thank you. We're already out of time. The texts are coming in. There's some from even caregivers. And I want to just quickly, one text, a caregiver of 2 aging parents. It's extremely difficult. You don't know if you're coming or going. It's one after the other. So we don't have time to talk about caregiving, but the importance of self-care is so important, Dr. Morais. We're going to have Claire Webster. That's her specialty. She's going to be on the show on February 18th. So caregivers, that's coming up. And Dr. Morais, I know you know Claire quite well, and she is amazing. So we want to listen there.
Yeah.
So we want to thank you. And that website, Dr. Morais, you said there was some free information
program on the web. Yeah, it's called, very easy, it's safe-senior.com.
safe-senior.com. Well, thank you very much for joining us here.
My greatest pleasure. Thank you for the invitation, Matt.
All right. Thank you. Dr. Jose Morais is the Director, Division of Geriatric Medicine at McGill University and a major contributor to the recently published book called The Care of the Older Person. Thank you for tuning in to Life Unrehearsed. And as a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, it'd be my pleasure to help. You can find out more. You could just look up Lianas Senior Transition Support. That's Lianas, Lianas, Senior Transition Support. Next week, we're going to be talking downsizing, maximizing the value of your home, and what to do to prepare for a doctor's visit for your loved ones. I want to thank our technical producer, Dan. Great job today. You can listen to Life Unrehearsed here on CJD 800 every Saturday